Some of the early signs in terms of autism spectrum disorder would be a language delay. And the second piece would be if language is emerging, but it's not functional. Another sign would be social delay. And then lastly, any unusual or atypical behavior patterns. So it could be sensory behaviors or repetitive or unusual play.
What are the popular myths that everyone gets wrong?
That everybody presents the same way. It's good to remember that autism is truly a spectrum. Individuals on the spectrum are going to present themselves very, very differently and are going to have various strengths and weaknesses. So when we're looking at younger children, oftentimes the presentation can be a little bit more severe.
Because there are different stages, most of the parents may not know when this change is happening, when they should seek help.
I always tell parents that they are the expert on their own child. And so when they are noticing concerns and, sometimes they'll be told, let's wait and see a little while or give them a little bit of time, I think it's best to kind of keep an eye on things, but we want to be proactive. I think by the time that parents go through seeking the evaluation, there's a certain level of acceptance that comes with, we have a concern here and we need to get some answers. Oftentimes the diagnosis is confirming maybe what they already knew or had questions about. And so to have the clarity often just provides a sense of relief and then a sense of control because now we can move forward.
Parents, they go to the doctor and their concerns are dismissed immediately because they don't have enough information. At this time, what should parent do?
If you don't feel like the pediatrician is responding to your concerns, you can always ask for
Our guest today is Dr. Ginger Martin, a licensed clinical psychologist with over 15 years of experience in autism evaluations, child psychology, and family support. She is the founder of Mindful Behavioral Health, where she specializes in helping families navigate the complexities of developmental disorders. Dr. Martin, what brought you into this field of, clinical psychology?
Yeah, so I've been really interested in clinical psychology for quite a while. It's something that I just always been drawn to, and specifically working with children. So I always knew that I wanted to work with kids in some capacity, and also really wanting to help provide sort of preventative services. So helping kids to learn skills and strategies and techniques to help them throughout their life. And so, I've really it's just been a passion of mine to work with children. And then through that, finding my way to specializing and working with children with autism spectrum diagnoses, which is just such a wonderful and fascinating group of individuals. And like I said, being able to watch progress over time and just to see some of the amazing strengths and capabilities that some of the individuals have is just amazing. But I truly love working with kids and families. I say to my husband, I think I laugh every day at work, just because working with kids just brings me a lot of joy. And so it's something that, has just always been a good fit for me.
Yeah, definitely, because you might be seeing like a lot of kids and the parents every day. It's also probably giving you like a lot of overwhelming situations time to time. Is that correct?
Sometimes, yeah. I mean, absolutely. That has come up where, sometimes it's just listening to a parent at an intake session where you could just feel how much they're dealing with and how complex it is and how demanding it is and how overwhelmed they're feeling. And for sure, sometimes that does, feel overwhelming and it feels heavy. And it's really a great focus to be able to provide some support and some direction and some answers for those families. So that's been just very rewarding, is to really encounter parents and families that are they don't know what to do. They don't know where to turn. They don't know what else is going on. And so to be able to provide some answers and some direction. And honestly, some of the relief that parents will indicate at the feedback meeting is just really rewarding and really, a great part of my job to be able to provide that.
Dr. Ginger Martin, can you provide a little more about your clinic, Mindful Health, and how it all started?
Um, I've been providing diagnostic evaluations and specific to autism for, like I said, probably well over 15 years, but in different capacities. And so I started mindful behavioral health, I believe it was in 2020, right after the pandemic, and sort of created my own private practice and really focusing on early childhood diagnostic evaluations, as well as outpatient therapy, cognitive behavioral therapy, parenting support. And now, as my practice has evolved, I've also included specifically working with mothers to provide support for, um, just the mental load of being a parent. And so I started in Pennsylvania, in Pittsburgh, worked there for many, many years, and in 2021 relocated to Florida. So my current practice is in Venice, Florida, but I do remain licensed in both Florida and Pennsylvania. And so I continue to provide evaluations here as well as consultation to families and children and moms in Pennsylvania and Pittsburgh as well.
So, Dr. Martin, do you only provide services for autism and ADHD, or do you also provide anything else?
Absolutely. So I do see a pretty wide spectrum of presentations. In terms of treatment, I see a lot of individuals with ADHD or anxiety. And then in terms of evaluation, often ADHD, autism, developmental delay, learning concerns, even just behavioral diagnostic evaluations will sometimes, I'll see those as well.
Also, can you tell us, because you work both in Pittsburgh, Pennsylvania, and also Florida right now? So, what are the key differences you see when it comes to either government provided assistance to kids with autism or ADHD, or anything like a child developmental things?
So it's definitely different. So each have different services and different avenues. Early intervention and obviously school systems are very similar in those services and supports that are available. I would say Pennsylvania is a little bit, well, at least in my experience, has been unique in terms of the amount of services that are available and the access to wraparound services. It has been something that has traditionally been sort of a very um, an easy, streamlined service line to get into, and something that's really beneficial to kids. So I would say in Florida, the avenues are just a little bit different. So helping families to get connected with the supportive services. Um, they obviously have very similar services here, but just different avenues and different ways to access it. So it's been helpful to learn that and to learn the differences and what's available and how to support families in both areas.
Since you're like provide services at the Pittsburgh and also in Florida, um, how any prospect parents or parents with the kids with autism, how they can reach out to you, or how can you tell us about the appointment things and the scheduling with you? Can some information?
Yeah, absolutely. So, um, on my website, there is both phone and email available to reach out with an inquiry. Um, if you're interested in consultation or just have some questions about services that are available, I'm always happy to either email or set up a time to speak by phone to talk a little bit more about the services and any particular questions that families are having. So the website is a great place to start.
Do you also take weekend appointments? Like, since you said like you're working a lot of the times.
I used to. I don't currently work on the weekends, but there definitely were years that I did. And so right now my schedule is a little bit more um during the weekdays. But for evaluation purposes, sometimes that's feasible for a one or two time appointment. Um, but yeah, no weekends right now.
Thank you, Dr. Martin, for joining us today and sharing your insights with our viewers. And we really appreciate your inputs. And we would like to see you back in the future as well. Thank you again.
Thank you so much for having me. It's really so nice to be able to speak with you today.